This presentation is intended for joint replacement patients at the Medical University of South Carolina and their coaches. It should be used alongside the Joint Replacement Patient Handbook. Thank you for choosing MUSC Orthopedics for your joint replacement surgery and care. Once you have been scheduled for surgery, you will be assisted through the process by a nurse navigator who is certified in orthopedic care. She or he will help you and your coach understand your care and be available to you as a resource for questions before, during, and after your surgery. Here are a few of the first steps to preparing for your surgery. If you haven't already signed up for MyChart on your computer and/or cell phone, this is a great resource to keep track of your appointments, test results, and message your surgeon's office. If you would like to also assign access to another individual, such as a family member who is more tech savvy or a spouse who can help track your appointments, this is also an option. If you smoke or use chewing tobacco or any other form of nicotine, your surgeon requires you to stop at least 4 weeks before surgery. A nicotine test will be one of the labs drawn during your pre-op appointment, and a positive result will lead to cancellation of your surgery. Between now and your pre-op appointment, schedule visits with any specialty doctors you have, such as cardiologists or pulmonologists, as well as your primary care doctor. Chronic conditions such as high blood pressure and diabetes must be under good control. For example, if you're a diabetic, your A1C must be less than 8.0. Also, if you have any dental pain or other concerns, schedule an appointment to see a dentist right away, as dental issues can lead to infection of your new joint. To proceed with surgery, you must have at least one adult coach to assist you for 1 to 2 weeks after surgery. In particular, you will need someone to stay with you through the night for the first week after surgery. Please note that most insurance companies now consider joint replacement surgery as an outpatient elective procedure. This means most patients are discharged home on the day of surgery. In a few rare cases, a patient may need to stay in the hospital overnight for additional medical support. Discharging to a rehab facility is even more rare, as most insurances don't cover any of the cost. In addition to providing support after surgery, hopefully your coach can come with you to your pre-op appointment too. If not, please make sure they read over the Total Joint Replacement Patient Handbook you received and forward this video to them so that they are prepared to provide the support you'll need after surgery. Preparing for surgery also includes eating the foods that will provide the right fuel for successful recovery. For instance, it will be important to get enough protein for your incision to heal quickly. Before and after surgery, focus on eating one source of protein, such as chicken, shrimp, or peanut butter, with each meal. If you aren't eating 3 meals a day or feel you aren't getting enough protein, consider adding nutrition supplement shakes like Ensure to your routine. Fiber is also helpful after surgery. The pain medication prescribed after surgery is notorious for causing constipation. Fiber will help prevent this issue and has the added benefit of helping to control blood sugar levels. As always, be sure to drink several glasses of water every day. This will also help with constipation. Try to avoid sugary drinks like soda and sweet tea, as well as other foods with high sugar content. Bacteria loves sugar, so the more that is available, the higher the chances are for infection. Before surgery, do what you can to make your living spaces safer and easier to use when you come home. You will be able to walk on your own while using a walker, as well as go up and down steps before you're discharged. That being said, you will be very slow with these activities and you'll find them very tiring at first. One of the most dangerous things that can happen after surgery is a fall. Remove loose rugs and other tripping hazards from your pathways, take precautions in slippery areas such as the bathroom, and clear paths wide enough for your walker to fit. Pets can be a tripping hazard too. Make plans for where your pet will stay after you come home from surgery, whether this is at your house or somewhere else, so that they aren't under your feet and can be walked as needed, fed, and cared for while you're recovering. Consider how you will get your meals after surgery. For instance, you might want to make a few meals ahead of time that are easy to heat up so you don't have to cook. You may also want to get takeout menus or contact Meals on Wheels for delivery to your house. Take care of any other loose ends so you can focus on your recovery. Also do your grocery shopping and fill any of your regular medications. For any needs that arise in the first couple of weeks after surgery, your coach should be able to help you take care of those. Throughout your joint replacement journey, one of our main focuses will be on preventing infection. When you come to the clinic for your pre-op appointment, some of the labs we collect will include a urine sample and nasal swab. Both of these are being tested for bacteria. Certain types of bacteria in urine need to be treated with an antibiotic prior to surgery to help reduce the risk of infection. If this is necessary, someone from our team will contact you. If bacteria is present on your nasal swab, this will be treated when you come in for surgery, so nothing needs to be done before your arrival. Additionally, you will be asked to use a special pre-surgery body wash that helps eliminate bacteria that is naturally present on everyone's skin. You will receive this soap from the pre-op clinic and start using it 5 days prior to surgery. Refer to your handbook for additional instructions. Several additional tasks will be completed during your pre-op appointment, including an EKG, blood work, and an evaluation by a hospitalist. If any additional follow-up is required after this appointment, your nurse navigator will help with coordinating what is needed. Otherwise, all of your test results have been reviewed during your appointment and you are considered cleared for surgery. As previously mentioned, it is extremely important that diabetes be under control prior to surgery to help reduce the chance of infection. This also applies to nicotine use. If you are still using nicotine prior to surgery or your diabetes shows that it is uncontrolled, your surgery will be postponed. If you have worked hard to ensure you are in the best condition for surgery, keep up the good work after your pre-op appointment to reduce the risk of surgery and increase the speed of your recovery. Soon you will be preparing for the day of surgery. Here you will find a list of tips and instructions for the night before and the day of surgery. You should pack an overnight bag. Although most of our patients are discharged the same day as surgery, it is a good idea to have a few essentials in a bag in case you need to be admitted overnight. You will find a suggested packing list in your handbook. Be sure to review the after visit summary that you received at the end of your pre-op appointment. Here you will find instructions for taking your regular medications in the days leading up to surgery and which medications to hold on the morning of surgery. On the afternoon prior to surgery, you will receive a phone call telling you what time to arrive for your procedure. If you have MyChart, you will receive a message on the app a day or two earlier. Remember not to eat any solid food after midnight the night before surgery. On the next slide, you will find instructions for drinking liquids the night before and the morning of your surgery. Once you check in on the day of surgery, you will change into a hospital gown and remove glasses, dentures, jewelry, and so forth. A nurse will perform a quick assessment and start an IV in your hand or arm. Before going to the OR, you will meet with your surgeon and anesthesiologist. Don't forget to go to the bathroom before being taken to the OR. During your surgery, your family and/or coach will be allowed to leave for a short period of time, so this is a good chance for them to get something to eat, a cup of coffee, or finish any quick errands. If they prefer not to leave, that's okay too. At any point, they can relax in the waiting room where the surgeon will step out to provide an update once surgery is over. On average, your procedure will take 2 hours to complete. You will be away from your loved ones approximately 4 hours to accommodate for prepping for surgery and for recovery. Once surgery is complete, you will be taken to the post-anesthesia care unit, or PACU for short, which is also known as the recovery room. Meanwhile, your surgeon will go to give your loved ones an update. As you wake up, you probably won't be able to feel or move either of your legs. While you are recovering in the PACU, your vital signs will be monitored, x-rays of your new joint will be taken, and you'll wear devices on your legs called SCDs, which help prevent blood clots. Your regional anesthesia will begin to wear off, and you'll be able to feel and move your legs again. However, this also means your pain will start to increase, so your multimodal pain control program will be started. This includes scheduled medications that you'll take around the clock, as well as on-demand medications for breakthrough pain. In addition, you will receive ice packs that you'll use continuously. Frequent repositioning, exercises, and elevation will also help significantly with pain control. Once your block wears off enough that you can move your legs and stand, which is usually about 2 to 3 hours after you wake up from surgery, you'll be assisted by a nurse or physical therapist to slowly move out of bed and take your first few steps with your new joint replacement. As you start to become more mobile, remember that your reflexes will still be sluggish and you'll be taking pain medicine. This, in combination with several other factors, puts you at a very high risk for falls. Be sure to always use your call bell for assistance when getting out of bed so that you don't fall. After successfully walking down the hall with a walker, going up and down steps on your own, becoming medically stable, and completing post-op education, most patients are discharged from the recovery room on the same day as surgery. Discharge is typically in the late afternoon. However, if the medical team determines that you need to stay in the hospital overnight, you will continue to be monitored by a nurse and work with PT. Medications to take home with you will be prescribed to the pharmacy before you are discharged. For patients having surgery in downtown Charleston, prescriptions are sent to the pharmacy within the hospital. For surgeries at the West Ashley Pavilion, they're sent to the pharmacy in Target. While you are recovering, your coach can pick up the medications so that you have them ready to take home when you are discharged. These medications will include pain medication, a blood thinner, and medication to help prevent constipation. Unfortunately, insurance does not cover a private home aid. These services can, however, be paid for out of pocket, and your nurse navigator will have a list of agencies if you're interested. Whether you received a walker during your pre-op appointment, already own one, or you're borrowing one, all patients should have a front-wheeled walker before the day of surgery. Please be sure you have a front-wheeled walker, not a rollator, as required by your surgeon. Insurance rarely covers additional equipment such as elevated toilet seats or shower chairs. If you would like to purchase any of these out of pocket, we recommend doing so prior to surgery so it arrives and is ready for you when you get home. Prior to being discharged, you will receive quite a lot of instructions from your operative team. Your coach should plan to be present whenever nursing or physical therapy are working with you. 2 sets of ears are better than one, especially when one of you is on strong pain medication. Once you're ready for discharge, please be sure your coach is present and ready to take you home. Typically, this is late in the afternoon, but your coach should be available anytime after 12 p.m. You and your coach will meet with the nurse before leaving to be sure you understand your medication instructions, activity restrictions and exercises, and post-op care. Here you have a list of checklist items to be sure you have before you leave. During the first week after surgery, focus on pain control and physical therapy. Pain and fatigue will slow you down from additional activities such as cleaning, meal preparation, and other chores around the house, so let your coach help with as much as possible. Continue to use your walker at all times and be cautious of tripping hazards. Turning in bed, changing positions frequently, and taking deep, full breaths helps prevent pneumonia and blood clots. It is important to also at least walk once every hour that you are awake. As previously mentioned, you will go home on a blood thinner medication, so be sure to take it as prescribed. You will have good days and bad days throughout your recovery. During the first week or two after surgery, it is unlikely that you'll reach a 0 on the pain scale, so the goal is to keep your pain level at a 3 or 4 or less. Remember to take as little pain medication as possible to stay ahead of your pain, but you need to control your pain enough to perform your daily exercises and get some rest. Swelling is the primary cause of pain. Ice and elevate your leg anytime you are sitting or laying down. If you have trouble managing your pain, contact your nurse navigator for further evaluation. If you begin to run low on any of your medications before your first post-op appointment, contact the ortho clinic for a refill. Please be sure to give your clinic at least 24 hours notice to coordinate refilling your prescriptions before you are completely out of medication. Also schedule a follow-up appointment with your primary care doctor after surgery. This is important for management of your regular medications, which may need to be adjusted after your procedure. You will have significant swelling in your leg, which may extend to your foot. You may also have significant bruising. Remember to ice and elevate your leg throughout the day. The surgical dressing over your incision should remain in place for 7 days unless otherwise instructed. You may notice areas of drainage on the bandage, which is normal. Contact the ortho office if your dressing becomes fully saturated, leaks, or you have any other concerns. This dressing is waterproof, so you can take a shower as soon as you feel ready. Many steps have been made to prevent infection. It is important to continue this infection prevention once you are home. As mentioned on the previous slide, the surgical dressing over your incision should remain in place for 7 days after surgery. For specific information about your dressing and how to care for it, refer to the discharge instructions you receive before leaving the facility after surgery. If your dressing begins to leak or you have any other concerns, call the ortho clinic right away. Do not take a bath, go swimming, or submerge your incision in any way. Be sure to wash your hands with soap and water frequently, especially after using the bathroom. Always wash your hands before touching your incision or surgical dressing. You should avoid dental procedures, including cleanings, for at least 3 months after surgery. Thereafter, for the rest of your life, you should take an antibiotic before having any dental work. During the first week or 2 after surgery, you may not have much of an appetite. You might not feel like eating 3 full meals every day, so focus on eating small snacks. Choices high in protein and fiber are a good idea. It is less likely that you'll experience nausea, but this may be a side effect of the pain medication. Even if you don't feel up to eating food, whether from nausea or lack of appetite, be sure to keep up with drinking plenty of water to avoid additional complications. Constipation is a very common side effect of the pain medicine. Drinking plenty of water is also a way to help prevent this issue, as well as taking the stool softener you were prescribed after surgery. If you continue to experience trouble with constipation, especially if you stop passing gas or have abdominal swelling, contact the ortho clinic right away. You might experience trouble sleeping during the first week after surgery. This can be due to pain and/or being unable to find a comfortable position. Many patients find sleeping in a recliner much more comfortable during this time. If you don't have a recliner or just prefer to sleep in your bed, use several pillows to prop yourself up and position yourself as needed. As a reminder, if you've had a knee replacement, keep your legs straight while resting and do not place a pillow behind your knee. We do not provide prescription strength sleep aids, but over-the-counter melatonin is a safe option while taking your other post-op medications. Between 2 and 3 weeks after surgery, you will have your staples removed, if necessary, and you will work with your physical therapist to graduate from the walker to a cane. If you are working with home health PT, you will be discharged around this time frame. If you have had a knee replacement, you will continue PT in an outpatient office of your choice. Along your journey, continue to refer to your patient handbook often. This resource contains valuable information, including additional post-op concerns you may encounter and what to do. It is especially important to contact your surgeon's office if you develop a fever, notice redness around your bandage or incision, experience increased swelling with tenderness or redness in your calf, or if you have a sudden increase in pain or drainage after surgery. If you think your incision is infected, notify your surgeon's office first. No other doctor should prescribe antibiotics for this without input from your surgeon first. Of course, if you ever experience chest pain, shortness of breath, difficulty breathing, episodes of dizziness with fainting, or vision changes, call 911 or go directly to the closest ER. Otherwise, if at any time you have questions or concerns, don't hesitate to contact your surgeon and his team. Thank you.